Yesterday the Taoiseach talked about being interested in the next generation and not the next election. You excuse my scepticism about his remarks when you look at the papers today. The heat must be getting to him in more ways than one. Nobody in this House would object to any plans for the next generation, and we're discussing it here today. But we also have to think about the current generation and the pressures that people are currently under in their daily lives. It's all very well talking about the macro investments in health and education being highest in the OECD, 10 billion in education, 15 billion in health, but the reality on the ground is very, very different. Families and patients on the ground are being made wait longer than ever. We have over 700,000 people on waiting lists. We spoke here last week about the 6,181 children on CAMS waiting lists. 6,400 people are waiting for home support hours having approved for them and cannot get them. Waiting lists for assessment of need under the Disability Act are the longest ever in many, many counties. And the number of consultant vacancies across the country is at its highest ever. There are approximately 450 approved consultant posts, which is 15% of the total in the country, which cannot be filled in the country on a permanent basis at the moment. Our acute hospitals, our mental health services are finding it impossible to recruit and to retain the number of consultants required and that are necessary to provide services to the people who are on these waiting lists. I spoke last week about Dr. Kieran Moore, and I remind you again of his comments when he resigned from his positions as a CAMS consultant in Wexford and Waterford. "I'm resigning because it's untenable and unsafe, and two of my colleagues are doing the same." Dr. Moore went on, he said patients are coming into a building that is quote-unquote in a state and that staff are burnt out, his quote. He said the mental health services required continuous funding and looking after the people who look after the patients. Many of the consultant vacancies are being filled by agency posts, which are up to 3 times the salary being paid to new consultants and new entrant consultants. The costs for agency consultants specifically are more than €100 million a year. Consultants are retiring early, as Dr. Moore has, because of low morale, because of pressure on the service and their inability to give the best service to their patients. We need consultants to lead our health service, to actually deliver to people who are on waiting lists. What exactly are you as a government doing to ensure that we fill these vacancies? This is the time of year for turnaround in hospitals, for consultants, and how many hospitals will be left without consultant-led services, and how many more people will join the 700,000 already on waiting lists under your watch. There's no sense in increasing training spaces when people do not want to wait in the service. When they look at senior people like Dr. Kieran Moore and many others resigning or retiring early because of low morale. What we need to do is to actively start filling the 450 vacancies that are there. And yes, there is international competition for those positions, but we are not at the races. Our pay structures for consultants, our backup for consultants are not at the races internationally. And there's no sense in having, your own phrase, active recruitment campaigns when we're not dealing with the issues, when they look at working as a consultant in Ireland, they look at the pressures that we're under. We need to address the waiting lists. It is unbelievable that trolley numbers in May in this country were higher than those in November. I was listening to your response there, and we have a cabinet of commentators in relation to our health service. You are in charge. We need proactive and decisive action in relation to this, or we will have more people on waiting lists, we'll have more trolleys, and we'll have more people suffering while you continue to commentate.